this is a top 10 we definitely don't want. So let's do something about that. This is Richard Ward, and I'm here to help various school districts and the citizens in those school districts to make proper decisions who to keep out of school and who to send to school. We need to get over this COVID situation, and the only way to do that is to follow the best science. And that science is set forth in a couple documents I talked about in this past video. And one of the key levels was this 25 daily new cases per 100,000 population. And if you exceed that, you probably should be in distance learning. And most of the Oklahoma schools right now are still, as of August 4th, in that category, in my view. Tulsa decided on this yesterday, on August 3rd, and they actually rejected the Oklahoma data and used the Harvard data from here. For example, Oklahoma. Let's go into the counties. And then we can see Tulsa County, 32.8, my county, 31.1, Wagner County, 27.4, for examples. So this is the screenshot of the Tulsa Public Schools at the correct point, 152.20. If you watch around that point, you'll hear their rationale for using the Harvard data, the date of testing data, as opposed to the Oklahoma summary of data. This is the Oklahoma summary of data, at least the chart part of it. This is the map. So we can see that 19.74 for Oklahoma County here, 19.74. But this is improper. They're using data points which are too close to the date. So this is from the 30th. That's the 30th. Those are supposed to be excluded. The CDC, in their president's plan for reopening America up again, says if you don't exclude those recent onset dates, last week or 8 to 10 days, really it should be 14 days or 17 days even, you'll give the false appearance of downward trajectory. And that is exactly what we're getting on the Oklahoma data. That's exactly what Tulsa's data had a false downward trajectory. The health department in Tulsa rejects that and uses the Harvard data. If you want to see something about the lag in testing, so like for example on the 30th here, 82% were from the past 2 weeks. That means 18% of the specimens are older than 2 weeks. We have a huge amount of lag in the data, and that's why CDC uses date of case report. We should be using date of case report right now and follow the Harvard data. That being said, the data is helpful. As you can see in Oklahoma, we reached 25. That's helpful. In fact, these will go up as we get more data in. Tulsa used this data as well. They said we were above 25 on this, so therefore we're going into orange too. I hope that was helpful to you. If you have any questions, again, I can be reached on Facebook Messenger or on email, patandhelp@gmail.com. Thanks for listening.